Okay. Good morning, good afternoon, and good evening to all of the ones that are joining us today. Welcome to the last webinar of this year. We're going to be talking about climate change, floods, and health. And I am Hilma Mantilla. I am a medical doctor by training and epidemiologist. Right now, I'm working with the Global Consortium on Climate and Health Education. I'm a professor at the Universidad Javeriana in Bogota, Colombia, and also part of the accreditation review of the TFNet program. I'm very happy to be here today to be moderating this section. We are going to be with 3 great speakers, one from Pakistan and 2 from Brazil. And they're going to sharing their experience on how the FETP programs in their countries are dealing with flooding in the framework of climate change. So just to give some overview about the topic, next slide, please, Heli. As you know, flooding is the most common natural disaster that is affected at the global level. We have some statistics from 1998 until 2017 that it says that around 2 billion people worldwide being affected by these disasters, and that most of the disasters in terms of worldwide are related with disasters are in terms of flooding. One of the things related with climate is that, as you know, the Intergovernmental Panel on Climate Change in the last report that it was published in March 2022 had been said that flooding is going to be increasing through the years and through the future decades, and of course are going to be alongside with a growing number of health outcomes. Other thing that is important to know, and probably in the presentation you will see, is that floods can be having direct and indirect human health effects. And they are not only in terms of the communities, of the vulnerable communities, but also they are related with what is happening with disaster responders, with healthcare professionals, and all of the infrastructure in terms of health care systems that also are affected. Next one, please. I just wanted to show a projections of how it's going to be the precipitation depending on the different scenarios that we will have in terms of what the last report of the IPCC said. And as you can see here, if we simulate that we will have an increase in temperature of 1.5 degrees Celsius or 2 degrees Celsius or 4 degrees Celsius, what will happen is that we will be increasing the intensity and also the frequency of precipitation in most part of the world, especially in high altitudes and the equatorial Pacific, and of course in parts of the monsoon regions. And basically just to get familiar with this type of figures, because this is important to understand what is going on and how we are going to respond eventually early in this type of disaster that it will happen with the increase of the precipitation. Next, please. And this is just basically something that I took from the internet of what is happening right now. This is like a list of flooding in the last 2 weeks that happen all around the world. As you can see, we have countries from different continents, from different regions. And of course, all of them are related with health impacts such as injuries and diseases, and of course, people affected for this extreme event. Next, please. And this is something that basically just wanted to show in terms of what are like the most common health risks of flooding. And as you can see, we go from injuries, hypothermia, waterborne disease, vector-borne disease, snake bite, undernutrition, and of course, all of the things related with epidemics that could be like cholera, COVID, or others. And of course, mental health problems. So with this, I just want to welcome again our speakers. Next, please. We will have, as I said at the beginning, 3 speakers, Dr. Madmans from Pakistan, Camille Rodriguez from Brazil, and Morgana de Frias from Brazil. So I will turn over to Dr. Matas, and I will just remind the speakers that we will have 15 minutes for their talk. We will start, as I said, with Dr. Matas, and 5 minutes before the 15 minutes will go over, I will give a warning for them. So, and we will have, after the presentation of our colleague from Pakistan, 5 minutes for questions. Please post your questions on the chat. And I think with this, we will start. Please, Dr. Khan, please take the floor. I don't hear you, Dr. Khan.
Now, I think this is audible. Hello?
Yeah, I can hear you. You can go on.
Okay. Thank you, Dr. Gilman. I am Dr. Mumtaz Ali Khan. I am the Chief of Center for Disease Control at National Institute of Health, Islamabad, and I'm also the coordinator for FELTP Pakistan. So I will be presenting. Just a minute. Is my voice audible?
Yes, we can hear you.
Okay. So today I'm going to talk about the climate effects in Pakistan. Let me start with. So I'm going to talk about the effects of climate change in Pakistan and recent floods and role of FELTP Pakistan. I will try to finish my presentation within time so that other can present and we can finish in time. As you know, Pakistan is the 6th most populous country in the world, lies in the mostly arid and semi-arid geographical area prone to recurring large-scale floods, earthquakes, droughts, and landslides. Pakistan is geographically located in a region where the effects of climate change are being felt fairly strongly. This climate disaster had enormous economic, social, and environmental consequences. Pakistan faces significantly higher average temperature than the global average, with a potential rise of 1.3 degrees centigrade to 4.9 degrees centigrade by 2090s over the 1986 to 2005 baseline according to the study. In Pakistan, the current median yearly likelihood of a heat wave happening in any specific region is roughly 3%. So that is very high. You can see from these slides that we have, despite recent economic growth, nearly 30% of Pakistan's 189 million people live below the poverty line, and high rates of malnutrition, food security persist. Climate change is expected to exacerbate these challenges. Like you can see, the agriculture, the water resources, the energy, the human health, and fisheries, and all other livelihood has been affected by climate change. You can see the effects of climate change on agriculture, forest, human health, water resources, impact on coastal areas and special and natural habitats. Natural disasters which already disrupted the livelihood of the economy and are expected to increase the frequency and intensity with passage of time. Projected temperature increase are expected to be above the global average. Potential impacts include health impacts and others. How Pakistan is vulnerable to climate change. I will be talking in next few slides about this. Pakistan climate challenges pose a national security emergency. A whole of the government approach is required now before climate change exacerbate conflict in the country. The government is taking solid steps to overcome the issue, but this is not possible only at local level. This needs regional and global level efforts to overcome on these issues. You can see from this slide, this is the average rise in temperature, average indexes showed from some studies. Pakistan faces some of the higher disaster risk level in the world, ranked 18 out of 191 countries by 2019. This is about informed risk index. The risk is driven particularly by the nation's exposure to earthquakes and the risk of internal conflicts. Pakistan also has high exposure to flooding, including riverine, flash, and coastal, as well as some exposure to tropical cyclones and their associated hazards and droughts. This is the area of Pakistan which you can see the highlighted in red. Here you can see Pakistan around here. And this shows for the first 20 years, Pakistan has consistently ranked among the top 10 most vulnerable countries on the climate risk index. The challenges threaten to spark climate-related conflicts over resources such as water, due to scarcity of water, due to climate change, impacts on climate-related disasters like floods, heat waves, or tsunamis can also exacerbate the tension among groups who are already have the history of conflicts. This slide shows climate change is now recognized to have a significant impact on disaster management efforts and pose a significant threat to the efforts to meet the growing needs of the most vulnerable population. Pakistan regularly experiences some of the highest maximum temperature in the world, with many regions experiencing temperatures of 38 degrees centigrade and above on an annual basis. When weather patterns coverage to deliver prolonged periods of heat wave, serious human health, it can result like recent floods we are experiencing, and I will be talking about the floods as well. You can see from these slides, the charts provides overview of the most frequent natural disaster in a given country and understand the impacts of those disasters on human health. So this is about Pakistan throughout a few years. You can see from 1980 up till now. And in the next slide, you can see the effects of climate change and the livelihood of Pakistani's population, which is already under threats and disasters. The global climate crisis poses a number of threats to the well-being and prosperity of the people of Islamic Republic of Pakistan. The country already witnesses several climate and weather-related natural hazards due to its geographical diversity and varied tropical continental climate. Pakistan experiences recurring heat waves and droughts, like you heard about drought in the Sindh province in last few years. Changes are expected to increase the frequency and intensity of these events as well as exacerbate people's vulnerabilities as well. It is projected that there will be significant increase in temperature across the country, and especially in the snow-covered mountains north, which is really a treasure for us for water, which will lead to faster glacial melt, resulting in changes to the Indus River flow downstream. And you can observe in the floods, this is due to that glacier melt. This is really a busy slide, but I will briefly discuss. Pakistan is facing considerably warm above the global average. The country already witnessed several climate-related hazards. The Global Climate Vulnerability Index, CCVI, compiled by Mapley Crop, ranked Pakistan as the 16th most vulnerable country. Significant increase in the temperature, significant increase in the faster glacial melt, which resulted in the floods, flash floods. So the government of Pakistan has established the Ministry of Climate Change and issued its second National Communication on Climate Change in 2019. So government of Pakistan is taking solid steps, but still we need to make more changes and more steps towards prosperity. You can see this slide. Pakistan lies in the temperature zone and its climate is varied in the country's different areas. Glacier melt has accelerated due to climate change, increasing the likelihood of glacial lake outpouring. And this slide shows the Pakistan annual climate cycle. You can see from January towards December, we have hot days during May, June, July, August, and downstream in the September. So Pakistan relies heavily on its climate sensitive land, water, and forest resources for livelihood of security. Climate changes has accelerated glacier melt, which resulted in floods. And we can say the glacier lake outburst floods, GLOB. This impact the health in many ways like heat, exhaustion, malnutrition, emergence of vector-borne diseases like malaria, dengue, and skin diseases, waterborne diseases, typhoid, and other diseases, like we are experiencing during floods right now. Stagnant water is the breeding site for mosquito-carrying diseases, and we are experiencing skin diseases in the province of Sindh and Balochistan right now. Women and children are more vulnerable and malnourished due to such conditions because they have been displaced from their own houses. Most of the displaced population are living in camps and many other has no place to go. So the healthcare services due to healthcare services damage has been disrupted. You can see from this slide some facts about the floods in 2022, the floods in 2012, and also the floods in 2010. So these are all about the.
Excuse me,
Yes,
Dr.
please.
Khan, you have 5 minutes left.
Okay, thank you. So I will be talking about the floods. Pakistan is passing through the worst floods in the history, and this year has been the wettest since record began 1961. And you can see from this slide the history of floods in Pakistan. This is a short slide in short history. So this year, Pakistan has been enduring severe monsoon weather since June 2022, and more than 1/3 of Pakistan was underwater. Territorial monsoon rainfall 10 times heavier than usual has caused the Indus River overflow, effectively creating long lake tens of kilometers wide throughout the country, from north to the eastern border. Since June and August 2020, flash flooding led to an unprecedented disaster, and around 33 million people have been affected by the floods, including near 8 million displaced, killing more than 1,700 people, and 1/3 of which were children. Almost more 1/3 of the district were affected throughout the Pakistan, and you can see from the slides. This is the data presented from yesterday's set trip. We are generating these set trips on daily basis, and this is the data from the NDMA website, which is regularly being updated. So the whole infrastructure of the health has been damaged. 1/5 of the affected facilities were fully damaged, the health facilities, malnutrition, diarrhea, and especially the pregnant women were facing challenges and getting access to healthcare. And there was substantial increase in the communicable diseases such as diarrhea, dengue, malaria, and the disrupted health services were another challenge for us. Vector-borne diseases, waterborne diseases, respiratory diseases, skin problem, eye infection, and snake bite and dog bite cases have been reported. You can see from the next slide that this is the state of affairs that we are facing right now at Pakistan due to flash floods. So I will briefly talk about the role of FELTP during these floods. You know, FELTP Pakistan has always remained very crucial during disease outbreaks and healthcare emergencies. And it was evident during COVID-19 pandemic that FELTP Pakistan is also proved itself as an important tool for strengthening the national public health response. So we worked at federal level with NFRCC, National Flood Response Coordination Center, at provincial level, and disease surveillance units, supporting provincial health department, posted at provincial disease surveillance units. We conducted field activities. We worked in emergency control zones. Our fellows are available in the field right now in Sindh and Balochistan, and providing daily sit reps as well. And we have mobile lab which was deputed to Sindh province and Balochistan as well. So all these were coordinated by FELTP Pakistan. Our fellows are involved in surveillance and response throughout the flood affected areas in different levels. And they are involved in risk communication and facilitating immunization, routine immunization and COVID. And also we are involved in rapid response trainings and response activities. NIH deployed BSL-2 lab supervised by FELTP fellows and Sindh province for routine diagnostic tests of infectious diseases. So climate change and health impact modules have been introduced to FELTP advanced course right now because this is the need of the time. And we are busy in capacity building of the staff at provincial and district level. This is the summary of the health impacts due to recent floods, increased heat-related mortality and other vector-borne diseases, diarrheal diseases, reduced access to health, and loss in life of livelihood from flood and landslide disasters in flood-affected areas. So this was all in a rapid manner from my side. Thank you so much.
Thanks a lot for a great presentation. We have a couple of questions for you, so I will ask them. So the first question is, what recovery plans do you have in place presently in terms of flooding?
Pardon, you can ask again.
What recovery plans do you have in place in terms of flooding?
So it was in one of my slides that we have emergency action plan developed, and now there is National Flood Response Commission at federal level headed by a three-star general, and all the departments are available in that, including the provinces. And they are working on housing, they are working on health facility rehabilitation, they are working on livelihood activities, even schools, even roads and bridges. So that is in place, and donors are also supporting the activities through that national action plan.
Okay, thank you. I have another question here that it says, what strategies has Pakistan used in order to educate the Pakistani people about the impact of climate change on health?
Okay, great question. So as I mentioned in one of my slides that in 2019, the government has created a new ministry with climate change, and they are working through academia, through NGOs and through a government structure. They are creating the awareness, and also now we are participating in multiple national and international conferences and activities to create the awareness among people and other vulnerable population.
Okay, thanks a lot. And here there is another one. Can you comment on impacts of flooding on health of livestock and thus nutrient-dense food supplies?
Yes, sure. Because this was not in my slide, but the affected livestock population, because the areas where flood has been flowing through it, all agricultural land, and we have destroyed the crops. We have destroyed this flood has destroyed the livestock and also the small and large animals. So this is another big area which we are going for recovery right now.
Okay, thank you. This one is, it says, it seems like FETP was quite heavily involved in the response to recent flooding. Has this always been the case historical for climate change disasters such as this, as you present?
Yes, since we have the FELTP since 2006 around are 7. Now we have 14th cohort on ground, and they are heavily involved in such disasters and earthquakes and outbreaks and other calamities like COVID and even HIV outbreak and all the disaster FELTPs are involved heavily and actively.
Okay. And beside that question, this one goes in terms of how did the Pakistan Minister of Health engage the FETP in response, and what skills are residents taught to be able to respond?
FLTP is basically part of the government. Our all FLTP fellows are government servants, and they are posted at a high level, decisional level, and operational level in all provinces and districts. Right now, at federal level, the DG Health is FLTP fellow. The immunization in charge and the NCUC head is FLTP fellow, and the NFRCC head and NCUC head is FLTP director as well. Right now, I'm the FLTP fellow and I'm heading the Center for Disease Control. And likewise, in district health departments and provincial health departments, we have multiple FLTP fellows right now at decisional and very important levels. So they are actively involved from the government side.
Okay, thank you. Well, I have a lot of questions for you, but I will take a couple of minutes just to ask two more. Here is one in terms of, it says, apart from the direct health impacts for flooding, the mental health of people who have suffered flooding can be negatively affected. Could you mention how Pakistan is addressing this issue?
We have some NGOs, those are working on livelihood and also on psychological aspects of the health and population. And also we have some NGOs, they are working for gender equality and women health and women issues. And some are working on poor population. So we have multiple NGOs, and also the government have some departments, they are working for that.
Okay, great. And I think, well, I have.
I can see one question. That what skills we are lacking. So
Yeah, I was going to add
so,
that one. Okay, go
so
ahead, please.
During COVID outbreak, we felt that our fellows should have emergency management skills. So now we have introduced this module to our FLTP program, the incident command management system.
Okay, following that one, so the fellows of the FETP right now are training on this module on climate change. Is that what you said?
We are going to introduce the climate change this year in the new cohort. Yeah, we have planned for that. Yeah, and also the UK HSA is working with us on that module.
Oh, great. Okay. I think that's part of what we want with this webinar, is just like to try to find out how many programs around the world are trying to integrate climate into their curriculum. And it's glad to know that you are going. Yeah, and I'm glad that you're saying that you're introducing this to the new cohort. Thanks a lot, Dr. Han. I think has been such a wonderful presentation. I hope we have like some time at the end of this session for some discussion. So thanks a lot, and I will turn on. Thank you. And I will turn to Camille.
Hi.
Hi, Camille, how are you?
I'm fine, and you?
I'm fine, thank you. So please go ahead. As you know, you will have like 15 minutes, and I will let you know 5 minutes before, so you will know that you will need to finish on time. Thank you.
Hello, good morning. My name is Camila Azevedo. I am a trainee at the Brazil Epidemiology Training Program, EPSUS. Next, please. Are you present to the work Epidemiological Response to Hydrological Disasters in Brazil? Syndromic Analysis of Problem. Next, please. Vocês estão conseguindo me ouvir? Acho que o slide não está passando. Hello?
Te ouvimos
Sim,
sim, Camila.
Ok.
Thank you. Então, to the work epidemiological response to hydrological disasters in Brazil. Syndromic analysis of probable diseases in the homeless population in Bahia 2021. Next, please. And as introduction, we have that emergencies in public health are situations that require the urgent use of measures to prevent, control, and contain risks, damage, and harm to public health in the following situations. Next, outbreaks and epidemics, disasters, and assistance to the population. Here the paper will focus on disasters. Next, please. Next. Disasters on the other range are events that constitute a situation of emergency or station of public calamity that imply direct actions in the area of public health. Shows of the natural types are classification in geological, hydrological, meteorological, climatological, and biological, with emphasis on floods. Next. These floods bring effects to human health that range from increasing occurrences of infectious disease, aggravations of chronic non-communicable disease, increased risks of disease transmissions, that to the agglomeration of people, shelters, and emergencies of mental disorders. Next. In light of the above, the objective of this work was, next please, to describe the epidemiological profile of the homeless population in the municipalities of south and far south of Bahia. Next. No. Next, no. In the period between December 23rd of 2021 and January 12th of 2022. Os slides estão passando para vocês? Para mim não está passando.
Tá passando sim, Camila. Estamos nos métodos,
Então
estudos.
está travado para mim. Para mim está travado. Então eu vou continuar. And a specific survey the problem case of the main existing disease in flood situation and propose recommendations. Has a methodology? Yes. We carried out a descriptive study called the survey of the epidemiological profile of the homeless in the period between December 23rd and January 12th of 2022. Having as places of the study the Southern Regional Health Center in the health regions Ilhéus, Itabuna, Jequié, and Valença, and the Southern Extreme Regional Health Center in the health regions of Teixeira de Freitas. Next. The study population was the homeless populations in the city of the South Regional Health Center and the Far South Regional Health Center in Bahia between December 23rd of 2021 and January 12th of 2022. Next. Has a source and collection of data who used primary data collected from a semi-structured questionnaire applied with the homeless population. The variables of interest collection are present in the following table. Next. For data analysis, we performed a syndromic analysis, which consists of classification diseases according to pre-establishment syndromes based on singles and symptoms. Next. For the syndromic analysis, we conducted a survey of the case definitions used in the Health Surveillance Guide. Next. Subsequently, create variables de análise in Epinfo. Next. Next. 173 variables were created. Next. Who went to the field and surveyed the signs and symptoms of the MLS. Next. And from this occurrence, the identifications of probable cases of the main diseases related to flood, acute diarrheal diseases, influenza syndromic, COVID-19, dengue, chikungunya, Zika, leptospirosis, and mental distress. Next. We used the Epi Info and Microsoft Excel software, and as to ethical aspects, we are supported by the law 8008 with those health surveillance actions. Next. As for the results, 667 interviews were conducted, of which 46 had the Gandu base, 381 had the Itabuna base, 121 had the Ilhéus base, 110 at Jequié base, and 9 in the Teixeira de Freitas base. Next. Regarding socio-demographic characteristics, 59.8% were family, with a median age of 24. 86.8% had family members in the shelters, and 61.1% received health counseling in the shelters. Next. When the syndromic analysis was performed, 54.9% were problem cases of influenza syndromic, followed by 39.3% of mental distress, and 22.3% of dengue fever. Next. As conclusion, next. Most of the MLS were family with a median age of 24. Influenza syndromic was the probable pathology with the highest frequency, followed by mental distress and dengue. However, the existence of COVID-19, acute diarrheal diseases, leptospirosis, chikungunya, and Zika cause concern and should be evaluated. Studies point to increase in the incidence of potential epidemic diseases in the periods after the floods, with an increase in communicable diseases. In addition to diseases involving biological agents, the literature also points to the impacts on the mental and emotional health of populations exposed to the floods. Next, please. From the work done, some recommendations were made to begin. Carried out the registers of how people and families hosted in the shelters, especially with information about health status and the presence of symptoms. Guide the handlers about measures to contain and spread virus, such as the use of masks and hand hygiene. Reported suspect cases of COVID-19 to health authorities for testing. Maintain mobile health teams provide assistance to the shelters. Maintain pharmaceutical assistance for homeless people with, again, medications needs, especially hypertensive, diabetics, and the people with altered mental health status. And promote mental health care for the homeless with psychological evaluation and monitoring of mental health stations. And next, we are some pictures from the field you work. And next, thank you.
Thanks, Camila. You got your presentation in 10 minutes. Thanks a lot. So you have 5 minutes left if you want to add something.
Carla, please.
Camila, você apresentou em 10 minutos. Se você quiser adicionar alguma coisa, se você quiser falar mais alguma coisa.
Estou aberta a questionamentos. Obrigada.
No, she hasn't anything more to talk, and she is available to questions.
Okay, great. So let's see if we have some questions for Camille. Okay. Well, I have a question for Camille. I think it was great, the presentation, but I was wondering if when you were like going through your investigation, you at one point you thought it could be good to use climate information as a variable just to improve the analysis of your investigation?
Let me translate, Dilma.
Okay.
A Camila, ela perguntou se você usou alguma variável relacionada a mudanças climáticas nas suas análises do evento.
Obrigada pela pergunta. Não, todas as variáveis que foram utilizadas para análise foram coletadas no questionário semi-estruturado que a gente aplicou nas visitas aos abrigos, com a população que estava desabrigada. Então, foram essas as variáveis que a gente utilizou para as análises. E, posteriormente, criamos variáveis no Epinfo para fazer a análise sindrômica.
Okay. No, she didn't use any variable related to climate change. She just used the questions presented on survey that they did with the population, and after they used the Epinfo to do the analysis with these variables.
Okay, thank you. I think it's just like a recommendation for the next investigation that maybe you will conduct. It would be great just to try to find out the meteorological or climate information in that region that could be useful to understand better what is happening with the flooding, and also how we can, I will say, intend to use that information to develop, for example, an early warning system and try to diminish the effects of flooding in that region. So that would be like something that I want to share, that it could be good. And that's why we're doing these webinars, because we think that is important for the FETP programs around the world to be aware that there is a climate information out there that they can use. And of course, we can not only react to the disaster, but trying to anticipate and to diminish the effects of the flooding. Thanks a lot. So I think then we will go. Okay, there is a question here for Camille. Just give me a second. Do homeless people in Brazil do in areas which are at risk of flooding? And how much of the incidence of mental health issues are due to exposure to flooding rather than other factors?
Sorry, Dilma, I lose the question. Was okay.
Got it?
Yes.
Okay.
Camila, a primeira pergunta é se as pessoas que moram no Brasil em risco nas áreas de risco de inundação, qual a incidência de problemas mentais nessa população devido à ocorrência das inundações, mais do que outros fatores. Se você teria essa análise ou algum estudo do Brasil que mostre isso, que pessoas que moram em regiões afetadas por enchentes podem ter uma prevalência maior de doenças mentais do que populações não expostas a essa inundação. Se você conhece algum dado sobre isso.
Durante a nossa atuação lá na Bahia, nós tivemos o apoio de uma equipe de saúde mental, né, que tem feito esse trabalho de resposta à questão de saúde mental para populações que são expostas a situações de risco, como os desastres. eles têm feito um esforço para conseguir mapear essas populações de risco. Eu não tenho conhecimento de um estudo já publicado voltado para isso, mas durante a nossa atuação na Bahia, a gente atuou em parceria com esse grupo. Inclusive, foi eles que incentivaram que a gente fizesse perguntas relacionadas à questão de saúde mental, para que a gente tivesse esse perfil relacionado à saúde mental nessa população que tinha sido afetada pelos desastres. Então, eu não tenho conhecimento de um estudo já publicado, mas se tem feito esforços para levantar dados relacionados à saúde mental dessas populações, já que continuamente nós temos desastres aqui no Brasil, e a gente sabe que esses são efeitos que podem vir a acometer, né, a população que sofre esse tipo de situação.
Okay. Camila said that in Brazil, she didn't know about any published study with data related to incidence of mental health problems in population exposed on flooding areas. But they, during this work in Bahia, they know a group work with this, with mental health of the population exposed, and they stimulate the FETP group on question the population about this. So it's a great effort to have this kind of data related to mental health, to try to work on it, to deal with it.
Thank you, Carla, for the translation. So there is here another question that is, it says, what is the difference of the proportion of the different disease that you describe between the general population and the population that you made the survey?
Camila, a outra pergunta é qual a diferença de proporção das doenças que você relacionou no seu estudo em relação à população geral? Pelo que eu entendi da pergunta, é a prevalência das doenças que você citou no seu trabalho na população afetada em relação à população geral, não afetada.
Obrigada pelo questionamento. Eu não vou saber dizer em números essa prevalência, mas essas doenças que foram pesquisadas, né, vamos dizer assim, na população de desabrigados, elas são doenças que ocorrem comumente aqui no Brasil, ainda mais que a gente viveu uma situação de desastre durante a pandemia, durante surtos de influenza que estavam acontecendo aqui no Brasil. E a intenção de fazer esse levantamento na população de desabrigados, da população que estava nesses abrigos, era justamente entender como estava o perfil epidemiológico dessa população, para que a gente, de forma rápida, pudesse recomendar ações. Então, a gente fazia esse levantamento dos sinais e sintomas, fazia essa análise sindrômica de prováveis doenças que estavam acometendo essa população, para que a gente pudesse fazer testes de Covid, distribuir máscara, subsidiar ações mesmo de forma rápida, para evitar surtos que comumente acontecem pós-enchentes, né? Então, são doenças que já comumente acometem a população brasileira, mas o foco realmente era frear surtos, mitigar essas consequências dentro dos abrigos, por exemplo, que era a nossa população-alvo.
Okay. She didn't have the numbers in her mind now, but the objective, but these diseases that they work there in Bahia are common diseases in Brazil, in Bahia, in another states in Brazil, and another places in the world, of course. And the objective of the study, the work there, was try to identify signs and symptoms on this population, on homeless people, to try to do recommendations like do tests, more tests, or use masks, try to stop an outbreak, a possible outbreak there. Okay?
Okay. Thanks a lot, Carla. Thanks, Camila, for your presentation. So we will go to the next speaker. That is going to be our last speaker for today. So welcome, Morgana, and please take the floor.
Good morning. I am Morgana, and I'm part of the team Field Epidemiology Training Program Brazil, and I will present the epidemiological profile of the population displaced by flood disaster in Bahia 2021. Next. As introduction, and in November 27, next. In November 27, Raven rays caused major damage in several municipalities of Bahia State. In December 9, the national group that's work with disaster indicated public health emergency situations of flood disaster in municipalities of the extreme south of the state. In December 12, the event was classified as response level 2 when the state level response capacity was exceeded. In December 13, the Ministry of Health of Brazil activated the Situation Room for health emergency response caused by floods. And in December 14, the state of Bahia requested an EPSUS team support. Next. The general objective was to describe the epidemiological profile of displaced population by flood disaster in 2 municipalities in Bahia in December 2021 and propose recommendations. Method. We conducted a descriptive observational study in the period from December 15 to 22, and the municipalities of Itamaraju and Medeiros Neto. Next. The population was composed of individuals registered in the active shelters of Itamaraju and Medeiros Neto, and the sample selections was not probabilistic. Next. We used primary data and conducted face-to-face interviews using a semi-extractive questionnaire. And next, we use a descriptive statistic by absolutely and relative frequency, and it uses Epinfo and Microsoft Excel. Next. We categorize the variables into socio-demographics, clinical epidemiological, and post-disaster situation. Next. Ethical considerations. This study is supported the Brazilian law, AGH, and the resolution 508 of the National Health Council, as it is a surveillance action, and we requested verbal consent from the participants. Next, prosximo. And results. There are the 299 people. Next, there were 299 people registered in the 14 active shelters in the period. Of these, 64.5% answered the questionnaire, 170 were from Itamaraju, and 23 were from Medeiros Neto. Our total of interview people was 193. Next. 54% were female, with 4 pregnant women identified, and 21.2% was 1 to 10 years old. Next. 66% were of the race color brown, and 43% were of the level of education was incompletely elementary school. Next. And 48.5% had income of less than 1 minimum wage, and the 73 symptomatic individuals were identified, cough the most frequent symptom. Next. And 54.3% had pre-existing hypertension, and the vaccination coverage of COVID-19 was 47.6%. Next. We detected 7 trauma, 4, 3 cut puncture, 1 accident and venomous animal, and 1 animal bite, and 1 physical aggression. Next. as limitations, we can cite information bias, the history of illness, accidents, and vaccinations were self-reported, nor using official means of proof. As conclusions, next. During the study, we found that the populations is similar distributed between genders. However, the most frequent age group was children. In a disaster context, children who are more vulnerable because of their lower immunity grow and develop conditions, require more attention. Is it important to share that these investigations are find direct epidemiological surveillance and immunization actors in children? Next. High number of people of mixed race, color, and low educations and income levels. This scenario highlights social inequality in emergence contexts, where the most vulnerable are the hardest, causing serious damage and losses. They may exceed the community's capacity to cope with the impact. Next. We also identify people with pre-existing disease, and hypertension was the most frequent one. The findings directive pharmaceutical assistance to people with specific needs, considering the singularities and needs of the most vulnerable groups. Next. We found that low levels of COVID-19 vaccinations was dangerous, considering the possible outbreaks of respiratory syndromes in the scenarios. Considering the crowded context, managers and healthcare professionals must understand the risk of the introductions and subsequent transmissions of COVID-19 and other infectious diseases in these settings. Next. Having these results in mind, we recommended to the municipal health secretaries of Tamaraju and Medeiros Neto to provide assistance to children, elderly, pregnant women, and people with special needs, to maintain pharmaceutical assistance for hypertensive people, diabetes, and people with mental health disorders, to perform immunization actions in the shelters, to monitor infectious and high transmission diseases in crowded conditions, to screen orientations and hygienic sanitary measures, to reserve space for pets. Next. Also, to provide the psychological evaluation and monitor the mental health status of the children, to notify possible cases of violence in the shelters and seek support from the competent authorities, and to establish a coordination for each shelter. Next. To the Bahia State Secretary of Health, we still recommended to provide the material and human resource to the municipalities during the emergency, and to support the shelter management, and to replicate the study in the other municipalities in flood disaster situations. These are some pictures of our activities. Next. 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 Thank you.
Thanks a lot, Morgana, for a good presentation. We have 5 minutes left of the time that we gave you. If you have anything else you want to share with us, it would be wonderful.
Morgana, a gente ainda tem mais 5 minutos do seu tempo, se você quiser compartilhar mais alguma informação.
Gostaria de agradecer, então, a oportunidade. Esse trabalho foi realizado com o apoio do FETP Brasil. A nossa atuação lá era mais no sentido de levantar o perfil epidemiológico dos desabrigados, né, no sentido de auxiliar mesmo na emergência. E Acredito que a epidemiologia pode evoluir, né, em modelos preditivos de riscos, mas nesse caso, nessa oportunidade, nós trabalhamos na forma da epidemiologia descritiva, apontando as prioridades e as necessidades locais.
Okay, should like to thank you for the opportunity to present the work, which the object, the goal of this work in that period in Bahia was collect data related to epidemiological profile of homeless people affected by flooding, by this disaster there.
Okay, well, I think we have like a lot of congratulations on the chat. I have here one question that it's, any plans to mitigate future effects among persons in low socioeconomic groups in that area?
Camila, algum plano para mitigar futuros efeitos da situação entre as pessoas de baixo perfil socioeconômico que vocês encontraram lá?
Sim, nós sabemos que esse tipo de evento no Brasil é recorrente e afeta principalmente as pessoas mais vulneráveis, como foi possível evidenciar no nosso trabalho, idosos, crianças, pessoas com necessidades especiais. E a nossa contribuição diante desse contexto foi um instrumento que elaboramos para diagnóstico situacional dos abrigos, aliado ao levantamento, né, dessas informações pela epidemiologia descritiva, e que a grande contribuição que a gente enxerga é chegar de maneira oportuna, porque é muito difícil conseguir prevenir esse tipo de desastre aqui no Brasil, pelas condições climáticas e pelas condições de saneamento básico e condições socioeconômicas. Então, é no sentido mesmo de alertar os epidemiologistas para que estejam atentos a esse tipo de evento aqui no território e poder atuar de forma mais oportuna possível.
She said that this kind of situation in Brazil is common, unfortunately, because of the geography, the socioeconomic conditions of these regions, and they did plan with recommendations to have alerts to help epidemiologists to guide in prevent more problems than that caused by the flooding itself.
Thank you, Carla, and thanks to all our speakers. I just want to go to a discussion section. I have some questions that I would like to ask to our speakers. So we will take about 10 minutes to do that, and then we will close the seminar. So I want to raise this question, and I would like to all the speakers to respond. How do you think FETP residents can apply their knowledge and skills to climate-related health impact such flooding? I don't know who wants to start, Dr. Khan or Camila or Morgana.
Please repeat the question.
Okay. Okay, go, Dr. Khan.
I said, please repeat the question.
I'll repeat the question. Okay, I will. How do you think FETP residents can apply their knowledge and skills to climate-related health impacts such flooding?
Definitely in Pakistan, our FELTP has already been trained for this because we are prone to flooding. Everywhere we are facing floods in different areas. But this year, these floods were the heaviest since 1960s. It was the heaviest floods because 1/3 of the country was under floods. So our FELTP fellows have been trained for such disasters because we have northern areas where we have flash floods, we have glaciers, we have even avalanches and other things. So we have these emergency modules in our FETP already.
Okay,
Ah.
thanks. Go ahead.
I will translate to Morgana and Camila. Meninas, a Camila e Morgana, ela perguntou como que vocês acham que as habilidades, os conhecimentos do grupo do FETP, no caso do Brasil do EPSUS, pode ajudar a trabalhar essas questões de mudanças climáticas.
Quer responder, Mó?
Yes, please. Morgana or Camila, who wants to go first? Morgana.
Bom, aqui no Brasil, nós estamos em processo de integração da atuação do FTP em situações de desastres. Esses trabalhos, eles elucidaram de uma forma descritiva o impacto dos desastres na saúde dessa população mais vulnerável, mas de toda forma, eu acredito que trabalhar essas variáveis climáticas, principalmente temperatura e umidade, como preditor, né, de possíveis eventos, possam nos ajudar e direcionar nossos esforços enquanto equipes de resposta rápida.
Morgana said that she believes that as Dilma recommended at the beginning, the use of data related to climate change, related to climate and meteorological condition, as temperature and humidity, could help to prevent, to alert in advance of the disaster occurrence, and then help to prepare the population, the health assistance team to deal with the situation.
Só complementando a Morgana, eu acho que o grande diferencial que as nossas equipes de campo têm é poder justamente ir a campo, estar perto dessa população, entender as necessidades, né? Então, acho que o grande diferencial dos programas de treinamento com o EPSUS é ter essa resposta no campo mesmo, de conseguir entender o que está acontecendo para subsidiar as ações. Então, acho que essas investigações que a gente apresentou foram primeiras oportunidades de outras que virão para o nosso programa de treinamento, de atuar como resposta aos desastres, e a gente já percebe, já estamos colhendo frutos disso, né? Como a Morgana falou, um checklist de diagnóstico situacional que a gente fez para os abrigos, outros instrumentos estão sendo desenvolvidos, então acho que o diferencial é esse, da gente poder ir a campo e estar próximo dessa população que é afetada.
Camila would like to add that one key point is the possibility of go to the field to help the team in that situation, and she pointed out also the situational diagnostic checklist that they did with the team in Bahia, and it's available to use in future occurrence too.
Thank you. I think it's agree with all of the responses, and I just want to stress that the climate information could be like some new variables that people could use in the FETP, because one of the things that I understand is that the FETP fellows knows exactly how to conduct an outbreak investigation. I think what we can add or we can incorporate is how we can use those climate variables in terms of how they can help us to predict or to anticipate, and not only to react when we have already the situation. So I think that is very valuable that we have people trained with these skills and with this knowledge, but I think we can add the climatological data in order to improve our surveillance systems. I have here another questions from one of our members of the Climate Health Working Group, from Giovanni. He'll say, there is any further comments on the role of FETP in flooding and health surveillance, in particular of displacement population, but also those remaining in their original residence?
Just to translate to
Yes,
the girls.
please.
The question is a pergunta é se tem algum comentário a mais do papel da equipe de campo, né, nesses momentos de inundação, na saúde da população, em particular nas populações deslocadas, né, afetadas, mas também naquelas que permanecem na sua residência de origem, né, os efeitos, os impactos da inundação na saúde, na vigilância em saúde das pessoas, em especial na população que permaneceu nas suas casas.
Eu gostaria de destacar que o trabalho que foi realizado pela equipe do FETP foi realizado em parceria com a Defesa Civil, de Desastres, a Cruz Vermelha, que são órgãos que trabalham com desastres aqui no Brasil. Então, tivemos o tempo todo apoio no sentido de orientação com relação aos riscos no processo de retorno às residências, então os riscos físicos, né, não apenas os epidemiológicos, mas também os riscos físicos, e nós trabalhamos, né, de forma intensa esse processo de orientação, né, desse retorno, juntamente com panfletos, material informativo, né, que auxiliaram as pessoas que tinham essa preocupação de retorno às residências, ou até mesmo aquelas pessoas que permaneceram nas suas residências após o desastre.
Okay, she said that they worked together with different organs, with different institutions in Bahia involved in the flooding response, and they do the orientations to the population that remain in their original homes, or in people that as well with people that go out of home for a period and then return to their house. So they do recommendations as how to prevent disease, how to protect of physical damage that could occur in this return to their original homes.
E destacando também, né, que além das equipes que a gente teve em campo, que foram a campo, durante o desastre, uma sala de situação de inundações, ela estava ativa lá na Secretaria de Vigilância em Saúde. Outros colegas do EPSUS estavam também participando dessa resposta, e como a Morgana falou, desenvolvendo instrumentos de educação em saúde, monitorando os eventos. Então, teve essa parceria das pessoas que estavam em campo com essa sala de situação que estava ativa lá no Ministério da Saúde.
Okay, Camila said that also there were a situation room to work with different stakeholders in the situation, and they have free communication with this group. This helped to manage and to do recommendations and to study the data on health surveillance and etc.
Thanks, Carla, for the translation, and thanks, Camila and Morgana. Dr. Khan, do you have any comments on that question? Oh, here's it.
I was typing the message to save the time. FELTP Pakistan is working with WHO on implementation of emergency disease surveillance system in flood affected districts. These are almost 17 districts right now completely hit by the floods, and we have implemented the EDSS with 92% compliance right now. Today, I attended the meeting, and we are receiving the data from all affected districts through EDSS software. And this has been implemented through FELTP Pakistan.
Dr. Khan, one question following your answer. There is like you are working with anyone from the meteorological agency in terms of working in all these different districts that you said? Or you just...
as I mentioned, we have National Flood Response Committee at federal level, and Meteorological Department is one of the important member of that committee, and we are working in close coordination with them.
Okay. And I'm just curious in terms of what you said is, have you find any barriers or challenges to trying to incorporate climate information in the surveillance systems for flooding?
Of course, this is the emergency time, and we are getting responses from climate as well as from meteorological department, and we are incorporating these. So we are working in a challenging environment. We are facing challenges, of course, but we are benefiting from their information.
Sorry, I have my microphone mute. Okay. Morgana, do you want to say something?
No.
Okay. Well, I have one last question for the presenters. Is related with I say most of you are saying that it's important to use climate information to improve the surveillance systems. But I'm wondering what are like the challenge to do that, to incorporate that information into the surveillance systems. I would like to know, what do you think about that? What are like the challenges, especially in Brazil? Because I understand that in Pakistan, they're working with the Met Service, but I don't know in terms of Brazil. So Camila and Morgana, do you have like any comments on that?
Camila e Morgana, vocês têm algum comentário sobre o uso dos indicadores relacionados de dados, né, relacionados a mudanças climáticas, a incorporação do uso desses dados nos sistemas de saúde, alguma barreira, alguma limitação?
Pela experiência que eu tenho, esses dados climáticos, eles estão sendo trabalhados, mas fora dos sistemas de informações oficiais, né? Nós temos o SINAM, que é o nosso principal sistema, mas já são feitas algumas análises, principalmente para arboviroses, doenças que circulam endemicamente aqui no país, e que já são feitas essas análises em que levam em consideração variáveis climáticas como preditor de riscos para o aumento de doenças. No entanto, eu gostaria de acrescentar que tivemos algumas dificuldades para o levantamento das informações no contexto de desastres, principalmente sobre situação vacinal, porque as pessoas perderam todos os seus documentos, então consistiu como uma limitação do nosso trabalho, em que é um contexto em que as pessoas estão voltadas para a recuperação dos danos, e a condição de saúde atual fica em segundo plano. Então, nós tivemos dificuldade de acesso a algumas informações.
Okay, regarding the climate variables, she said that it's a little bit difficult to work with these data in Brazil because they are on different systems of information. It's that there is no one system with all data. She told about the arbovirus surveillance. In this case, there are some climate data in a system with health data related to this disease, to arbovirus. So they could work this data better and do some actions and propose some actions to these situations. But we have a long way to percorre in Brazil to better work with these climate data.
E só complementando, né, durante o nosso treinamento, os profissionais do EPSUS ficam alocados em diferentes áreas, e aí essas questões climáticas elas são abordadas nessas diferentes áreas, né? Isso é importante para que a gente consiga atuar em respostas como as inundações. Então, trazendo a minha experiência, eu estou trabalhando com as doenças crônicas, e lá a gente tem monitorado algumas questões climáticas relacionadas à poluição do ar, por exemplo, com as doenças crônicas. Tem a questão das arboviroses, como a Morgana trouxe. Então, essa possibilidade de nós estarmos em diferentes áreas técnicas lá no Ministério também contribui para que a gente consiga atuar nessas situações de desastre e utilizar esses dados relacionados às mudanças climáticas em diferentes doenças, né?
Okay, Camila said that in Brazil, the people engaged on EPSUS, on FETP program, working in different, they are based in different technical areas inside the Ministry of Health. So they can work with different kinds of diseases. She said that she is working with chronic disease, and in there she has access to data related to air pollution and diseases. So the students can the FETP students can use this data in different kinds of disease, in different kinds of situation, and when they are required to go to the field, they use their knowledge in these disaster situations.
Thanks a lot, Carla and Morgana and Camila and Dr. Khan. I think we have been in like a wonderful seminar. I just want basically to close the seminar saying that we have a long run to go to use climate information into the improvement of surveillance systems. But I think as Pakistan show us, there are options to work together with people who can give us like the data and also work with us in their analysis. I think we have like a great community in terms of the FETP programs that we can join forces with other sectors, especially with the Met Office, to try to improve and to see if we can develop early warning systems, and that we start not only counting the damage, but anticipating the damage and avoid a lot of impacts in health, not only in lives, but also in terms of infrastructure. So thank you very much again to all the speakers, and we will see you again next year. We will start these webinars probably at the middle of February, and we will be in touch with the different programs that are right now incorporating climate information into their programs, because we want to see if there is an option to develop training material that we can use to introduce to the different FETP programs around the world. Thank you so much, and see you again next year, and happy holidays for all of you, and thanks again. Bye-bye.
Thank you. Bye-bye. Thank you. Thank you.